Most people believe that supplements are the safe option. After all, if it comes from nature, if you can buy it without a prescription, if every health influencer on the internet is recommending it, it must be harmless, right? I used to think that way too. Then I started counting the seniors who came through my operating room with damaged hearts, weakened arteries, bleeding complications during routine procedures. And when I asked what medications they were taking, they'd list their prescriptions carefully. But when I asked about supplements, the answer was almost always the same. Oh, those don't count. Those are just vitamins. Those are natural. Here's what nobody tells you. 6 of the most popular supplements seniors take every single day are interacting with your heart in ways that can turn a routine surgery into a nightmare, spike your blood pressure while you sleep, or quietly thin your blood to dangerous levels without a single warning sign. And the worst part? Your annual checkup will never catch it. Stay with me. My name is Dr. Michael Hartwell. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,300 chests in my career. I've held beating hearts in my hands. And I've spent nearly 3 decades watching the same preventable pattern repeat. Patients who walked into my office believing they were doing everything right, taking their prescribed medications exactly as directed, eating better, exercising when they could, and adding a handful of supplements every morning because, well, that's what responsible seniors do. But those supplements, the ones nobody thinks to mention, the ones that seem too harmless to matter, were creating silent complications that changed outcomes on my operating table. Today, I'm going to tell you what nobody took the time to explain to them, what those 6 supplements are, what they're actually doing inside an aging body, and what you need to do starting tonight if you're taking any of them. Before we go through the list, you need to understand why your body after 65 is fundamentally different when it comes to supplements. Think of your body like an old car that's been running perfectly for decades. Same engine, same frame. But the margin for error has changed. When the car was new, you could ignore a small oil leak, push it a little too hard, run it on cheap fuel. The system had enough reserve to compensate. The cooling system could handle extra heat. The transmission could absorb rough shifts. The suspension could take a few potholes without damage. But after 200,000 miles, that same small oil leak can cause catastrophic failure. The engine seizes. The transmission slips. The suspension cracks. There's no buffer left. Your kidneys, your liver, your heart, they've been processing everything you put into your body for more than 6 decades without asking for a break. And they're still working, but their processing capacity isn't what it was at 40. The filtration rate in your kidneys drops by about 1% every year after age 40. By 65, you've lost 25% of your kidney function even if your blood tests look normal. Your liver, which metabolizes every supplement, every medication, every toxin you encounter, has fewer functional cells, slower enzyme production, reduced blood flow. More than 60% of adults over 65 are on at least 3 prescription medications. Add supplements on top of that, and your liver is running a 24-hour filtration operation it was never designed to sustain at this intensity. The enzyme systems that break down and clear these substances slow down. The protective mechanisms that prevent toxicity lose efficiency, and the blood vessels that used to handle fluctuations in blood pressure, blood thickness, electrolyte balance, they're stiffer now, less elastic, less forgiving. When you're 30 and you take too much of something, your body compensates. When you're 70 and you take too much of something, your body can't keep up. That old car analogy? This is it. Smaller margins, bigger consequences, and nowhere is that more dangerous than with supplements that interact with your heart. Now let me walk you through the 6 supplements. And I want to be very clear about something before we start. I am not saying supplements are inherently bad. I am saying that after 65, the rules change. And if you don't know the new rules, you're gambling with your heart. Number 1. High-dose calcium supplements without vitamin K2. Let me ask you something. How many of you were told at some point, usually by a well-meaning doctor during a bone density conversation, to take 1,000 or 1,200 milligrams of calcium every day? If you raised your hand, you're in the majority. And here's the part nobody explained. When you flood your bloodstream with calcium and you don't have enough vitamin K2 to direct that calcium into your bones where it belongs, your body has to put it somewhere. And where it ends up is the last place you want it: your arteries. Specifically, the smooth muscle cells in your arterial walls. This is not a theory. This is measurable. It's called vascular calcification. Your arteries, which should stay flexible to handle the surges in blood pressure that happen every time you stand up or climb stairs, start to harden. They lose their ability to expand and contract. Think about a garden hose. When it's new, it's flexible. You can bend it, coil it, run high-pressure water through it without damage. But leave that same hose outside for 10 years. The sun breaks down the rubber. It becomes stiff, brittle. Try to bend it and it cracks. That's what calcium without K2 does to your arteries. They calcify. They stiffen. Blood pressure rises. The heart has to work harder to push blood through vessels that won't flex anymore. And over years, that calcified plaque becomes the foundation for blockages, for strokes, for the kind of damage I see on imaging scans in the cath lab. I had a patient 2 years ago. I'll call her Barbara. 68 years old, retired teacher, took her calcium religiously every morning for nearly a decade because her doctor told her it would protect her bones. And it did. Her bone density was excellent, but her coronary arteries looked like tree branches covered in frost. We had to place 3 stents. The first thing she said to me after the procedure was, "I thought I was doing the right thing. Why didn't anyone tell me about K2?" That question has stayed with me. Here's the fix. If you're taking calcium, you need to pair it with vitamin K2 MK7, 100 to 200 micrograms daily. That's the form that activates the proteins that pull calcium out of your bloodstream and deposit it into bone. If your current supplement doesn't list K2 on the label, it's incomplete. Starting tonight, either add K2 or stop the calcium until you can get the right combination. Write that down. Number 2. Fish oil at doses above 3 grams per day. I know what you're thinking. Fish oil is heart healthy. Omega-3s are anti-inflammatory. Cardiologists recommend them all the time. All of that is true at the right dose. But here's what happens when seniors take mega doses, the kind you see marketed as extra strength or triple potency. Fish oil is a natural blood thinner. At 1 to 2 grams per day, that's usually beneficial. It reduces clotting risk, improves circulation, lowers triglycerides. But above 3 grams, especially in people already taking aspirin or a statin or any other medication that affects clotting, you're pushing your blood into a danger zone. And the problem is, you won't know it until something goes wrong. A fall that should result in a bruise becomes a subdural hematoma. A minor nosebleed won't stop. A routine dental extraction turns into a bleeding event. I've stood at an operating table at 3 in the morning holding a heart that wouldn't stop oozing during a straightforward valve replacement. Not because the surgery was complicated, because the patient had been taking 4 grams of fish oil daily for 6 months and nobody, not even the pre-op team, thought to ask about it. After 65, your clotting factors are already slightly compromised. Your platelet function declines naturally. Adding high-dose fish oil on top of that is like removing the emergency brake from a car that's already rolling downhill. The fix here is simple. If you're taking fish oil, check the label. Add up the EPA and DHA. If the total is above 2 grams, cut it in half. And if you're scheduled for any kind of surgery, even something minor, stop fish oil entirely at least 1 week before. Your surgeon will thank you. Here's here's where it gets complicated. 2 more items after this one. And item 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. Number 3, ginkgo biloba for memory or circulation. This one breaks my heart because the intention is so understandable. Memory starts to slip. Focus isn't what it used to be. Someone recommends ginkgo because it's been used for centuries, because it increases blood flow to the brain, because it's natural and safe. Denidar kumedakin dirsad. And in isolation for a healthy 40-year-old, maybe it is. But after 65, ginkgo has the same problem as high-dose fish oil. It thins your blood. And it does it through a mechanism your doctor isn't testing for. Ginkgo inhibits something called platelet activating factor. That's the chemical signal that tells your platelets to clump together and form a clot when you're bleeding. Without that signal working properly, even small injuries don't stop bleeding the way they should. I've seen this show up in the most unexpected ways. A patient who cut their finger chopping vegetables and couldn't get it to stop bleeding for 20 minutes. A woman who developed bruising all over her arms and legs and had no idea why. When we dug into their supplement list, ginkgo was there. Every single time. And here's the part that makes this especially dangerous. Ginkgo is often taken alongside aspirin or Plavix, medications that are already blood thinners. The combination is cumulative. Your blood gets thinner and thinner, and because there's no regular test that measures platelet activating factor, nobody catches it until something bleeds that shouldn't. Does any of this sound familiar? You're not alone. The fix is not complicated. If you're taking ginkgo and you're also on any kind of blood thinner, even baby aspirin, stop the ginkgo. If you're taking ginkgo and you notice unusual bruising, nosebleeds, or prolonged bleeding from small cuts, stop immediately and talk to your doctor. There are safer ways to support memory. Ginkgo after 65, especially in combination with other medications, is not worth the risk. Number 4, high-dose vitamin E, anything above 400 international units daily. For 15 years, I told my patients that vitamin E was protective, antioxidant, heart healthy, good for circulation. I recommended it routinely, especially to patients with a family history of heart disease. And then the research caught up, and I had to admit I was wrong. High-dose vitamin E, the kind you find in those big 1000 IU soft gels, does 2 things that are dangerous for aging hearts. First, it thins the blood, just like fish oil and ginkgo. But second, and this is the part I missed for years, it interferes with vitamin K. Not just K2, the kind we talked about with calcium, but vitamin K1, the form your liver uses to produce clotting factors. When you take high-dose E for months or years, you slowly deplete your body's ability to clot properly. And again, this is silent. There's no symptom, no warning sign. Wadorsandi or san E. Until you fall, until you need surgery, until something inside you starts bleeding and won't stop. I can already hear the skepticism, and honestly, good. Healthy skepticism is what keeps us from falling for nonsense. So let me show you exactly why this works. The landmark study that changed my mind was published in the Journal of the American Medical Association. They followed over 135,000 people taking high-dose vitamin E. The result? Increased risk of hemorrhagic stroke. Not decreased, increased. That's a stroke caused by bleeding in the brain, the very thing we're all trying to prevent. After 65, your risk of hemorrhagic stroke is already elevated because your blood vessels are more fragile. Adding high-dose vitamin E on top of that is playing with fire. The fix? If you're taking vitamin E, look at the dose. Anything above 400 IU daily, cut it down or stop it entirely. You can get all the vitamin E your body actually needs from food, almonds, spinach, sunflower seeds. Your heart doesn't need a supplement. It needs you to stop overloading it with things that cause more harm than help. Number 5, St. John's wort for mood or sleep. This one is tricky because it's one of the most researched herbal supplements out there. And yes, it has real effects on serotonin, which is why people take it for mild depression or anxiety. But here's what almost almost nobody talks about. St. John's wort is one of the most powerful enzyme inducers known to medicine. What does that mean in plain language? It speeds up the rate at which your liver breaks down other medications. And when your liver is working faster, the medications you're taking, the ones keeping your blood pressure controlled, the ones preventing blood clots, the ones managing your heart rhythm, they get cleared from your system before they've had a chance to do their job. I've had patients whose blood pressure spiked 20 points within 2 weeks of starting St. John's wort because it was accelerating the breakdown of their BP medication. I've had patients on warfarin, a critical blood thinner whose INR levels, the measure of how thin their blood is, dropped dangerously low, putting them at stroke risk because St. John's wort was clearing the warfarin too fast. And the scariest part? Most patients don't connect the dots. They don't think to mention an herbal supplement when their doctor asks what medications they're taking. After all, it's just an herb. It's not a real drug. But your liver doesn't make that distinction. To your liver, St. John's wort is a chemical that changes how every other chemical in your system behaves. If you're on more than 2 prescription medications and you're taking St. John's wort, you're flying blind. You have no idea whether your medications are working at the levels they're supposed to. The question to ask your doctor, write this down. If I'm taking St. John's wort, do we need to recheck my medication levels or adjust my doses? Most doctors, if they know you're taking it, will tell you to stop it entirely. The risks far outweigh the benefits. Number 6. Potassium supplements without medical supervision. Potassium is essential. Your heart can't beat without it. Your muscles can't contract. Your nerves can't fire. And yes, many seniors are low in potassium, especially if they're on diuretics, the water pills used to control blood pressure or heart failure. So it makes sense that someone would think, I'll just take a potassium supplement to fix that. But here's the danger. Your kidneys regulate potassium with almost no margin for error. Too little and your heart rhythm becomes unstable. Too much and your heart can stop. Literally stop. Idet adendedi ansatso. The condition is called hyperkalemia, and it is a medical emergency. After 65, your kidney function declines. Even if your creatinine levels look normal on a standard blood test, your kidneys are not clearing potassium the way they did at 40. Add a potassium supplement on top of medications that also raise potassium. ACE inhibitors, ARBs, spironolactone, and you can push your levels into the danger zone within days. I have seen patients admitted to the ICU with life-threatening arrhythmias because they started taking potassium supplements without telling their doctor. The heart monitor shows a rhythm that looks like it's about to flatline. We have to give emergency medications to bring the potassium down. And when we ask what changed, the answer is always the same. I just started taking potassium because I read it was good for my heart. Potassium is not something you guess at. It is not something you supplement based on an article you read online. If you think you need more potassium, the answer is food. Bananas, sweet potatoes, spinach, avocados. Those sources are self-regulating. Your body absorbs what it needs and excretes the rest. Potassium pills bypass that system and dump a concentrated dose directly into your bloodstream. If you're taking a potassium supplement and you haven't had your levels checked in the last 6 months, stop it now and get blood work done. This is not optional. Your heart's rhythm depends on it. I want to be honest with you for a moment. Not as a content creator, as a surgeon, I have stood at an operating table at 3 in the morning holding a heart that was struggling to maintain a normal rhythm because the potassium level was too high. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. In case after case, the contributing factors were not mysterious. They were ordinary supplements taken with good intentions. Calcium without K2, high-dose fish oil, ginkgo, Vitamin E, St. John's wort, potassium. These are not exotic risk factors. They are the background noise of millions of ordinary mornings. Pill organizers on kitchen counters, bottles lined up next to the coffee maker. And that background noise, accumulated day after day, year after year, changes outcomes. I want to tell you about a patient. I'll call him Richard. 71 years old, retired mechanic, sharp as ever, still working on classic cars in his garage on weekends. He came to me after a routine echocardiogram showed calcification in his aortic valve. Not severe yet, but enough that we needed to monitor it closely. When I asked about his medications, he listed his blood pressure pill, his statin, his baby aspirin. Then I asked about supplements. Oh, he said, just the usual: calcium for my bones, fish oil for my heart, some ginkgo because my memory's not what it used to be, vitamin E, and a potassium pill because I read it helps with cramps. He'd been taking that combination for 7 years. We ran a full panel. His calcium score, a measure of arterial calcification, was in the 90th percentile for his age. His potassium was borderline high. His INR, the clotting measure, was on the edge of too thin. I stopped all 6 supplements. We added K2. We adjusted his fish oil down to 1 gram. We focused on food-based potassium. 6 months later, his potassium was normal. His clotting normalized. The valve calcification hadn't progressed. The first thing he said to me at that follow-up visit was, "Why didn't anyone tell me this 7 years ago?" That question stays with me. It's a big part of why I make videos like this one. Let me give you the summary. 6 supplements to stop or adjust after 65. Number 1, high-dose calcium without vitamin K2. Add K2 or stop the calcium. Number 2, fish oil above 3 grams daily. Cut the dose in half. Number 3, ginkgo biloba, especially if you're on blood thinners. Stop it. Number 4, vitamin E above 400 IU. Reduce or eliminate. Number 5, St. John's wort if you're on prescription medications. Stop and talk to your doctor. Number 6, potassium supplements without medical supervision. Stop and get blood work. Which of these 6 are you taking right now? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who is taking at least 2 of these supplements and has no idea what they're doing to their heart. Send this video to them. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day for 65 years, 70 years, 75 years without ever asking for anything in return. Give it this. Take care of your heart.